let's look around. Let's look at this, gentlemen. I have to admit, there are days where I wondered, you know, we all have that moment of when is it going to happen, not if, but elevator shaft going in there, they've ripped down all the overhang, they're tying into the hospital. It's
well, the architectural designs look beautiful. It's going to be such a great addition to the hospital.
It's impressive, and I'm sure the workers are going to be, this will hopefully be a bit of a passion project for them.
I'm also very happy to see that with fundraising completed, my job is ended. Hey, you're just starting.
I think you can retire, Paul.
Thank you.
From your second full-time job.
This was fun, nothing but fun. Great people to work with, and enjoyed every minute of it.
And of course, to our donors, can't say thank you enough.
Spectacular.
When this is open, the impact that's going to happen for our friends, our families, to have that quality care close to home, thanks to you, we're making it happen.
It certainly is a privilege to welcome you to this milestone moment for Thunder Bay and for all of Northwestern Ontario. Today, we break ground on something transformational. The cardiovascular surgical program we're building will forever change access to care across our region. It means that patients, roughly 300 per year, will no longer need to leave Northwestern Ontario for life-saving surgeries. This is equity in action. To MPP Kevin Holland, thank you for being a vocal champion of this project. Your leadership in the legislature has made a real impact on our community and in this region.
It's really an honor to join you today as we celebrate this major milestone. And I'm proud to share the progress being made right here, where we are hard at work building the region's first cardiovascular surgery program. This is more than just a construction project. It's a declaration of hope, innovation, and care. It's proof once again of our government coming through on the promises we made to invest more in northern healthcare than any other government in Ontario's history.
Personally, it's hard to put into words what this day truly means. After more than a decade of work, it's the first time we can see and be able to say with absolute certainty that this is really happening. The cardiovascular surgery program isn't just a project. It's a promise we made to this region many, many years ago. After years of planning, unplanned delays, and challenges none of us saw coming, we're finally seeing that promise become a reality. Today gives us a chance to pause and acknowledge the people who made this possible, and these were our generous donors in the region. Our community invested first. We were the early believers. Individuals, families, local businesses, and volunteers stepped forward because they believed that the people of Northwestern Ontario deserved access to life-saving cardiac and vascular surgery close to home and close to the people they love. I had the honor and privilege of being the chairman of Our Hearts Have Home campaign. And thanks to our extraordinary cabinet team and the remarkable donors, this campaign has become the largest fundraising initiative in the history of Thunder Bay Regional Health Sciences Foundation. To date, we have raised over $20 million, which is absolutely incredible. Every single gift, large or small, has helped build the foundation for what's coming next.
With this vision at the Thunder Bay Regional Health Sciences Centre, the future is that patients will no longer have to leave Northwest Ontario for cardiac care the same way as they no longer leave for vascular surgery care. We couldn't be prouder to be part of this partnership and really look forward to the day where patient number one has their successful cardiac surgery in Thunder Bay. Thank you very much.
Well, Paul, it's a pretty special day today.
Really special, really special. This is 10 years in the making. And when you think back to how we first started, this was going to be a project that was going to be somewhere in the neighborhood of a total cost of $40 million, and we had a campaign goal of about $8 million.
Exactly.
And over the course of time, things just changed, and COVID came about, numerous hospital changes with administration, and the project got bigger. And all of a sudden, the cost rose to in excess of $100 million, and our campaign goal just kept on going up and up and up. And it was a challenge. We didn't know if we were going to be able to keep on going out there, but with the this assistance we had from the foundation and the tremendous cabinet we had, this region, just the donors were absolutely extraordinary. And we called on some real big donors, and the gifts were incredible. It was just fabulous.
Well, Mark, you remember that first proposal, it was going to be within the existing footprint of the hospital. We didn't envision a 76,000 square foot addition that's going on right behind us.
No, I remember that very well, that I think our original instructions were, as you say, to keep it within the footprint of the hospital, not build any new operating rooms, just renovate old ones. And there were a number of other stipulations, and we endeavored to do that, but I think the new project with a new whole wing to the hospital is far superior, and I think it'll be a much better job than would have been done 15 years ago.
Paul, how many decades you've been around healthcare philanthropy and fundraising for the new hospital itself back in the 90s, the early 2000s?
It's been 4 decades for me of volunteering for healthcare services in Thunder Bay.
This has to be pretty sweet for you personally.
I love this. This is absolutely fabulous, and to see the commitment from the region and local donors to support this project was just absolutely outstanding.
One of the things you said this morning that really rang true for me resonated was the early investors.
Yep.
Like often, these projects, the government's on board first and they say, now you have to raise the local share. We raised the local share first.
Absolutely, absolutely. Before we had a full government commitment, our local share was already contributed. And if you remember those early days, it was the big rocks that we were getting right off the bat, and big donations of $250,000, $500,000, $750,000, and of course our 2 donations that were $1 million,
which is
incredible.
All those donor calls that we made, everybody had a story.
Yep. Everybody
knows somebody firsthand, a family member, a friend who had to go to Toronto, Hamilton, Ottawa. Great care, but 1,000 miles away, a plane ride away.
Yep.
And Mark, when you came here for interventional cardiology, what did we anticipate for numbers?
Yeah, so when I came here in 2008, all the experts from the ministry had said that you will never need to do more than about 500 angioplasties a year in Thunder Bay based on the hospital and the population that we serve. Well, I think we did 500 the second year, and now it's about 1,000 a year. And I think
so. Not a great stat, but an important stat,
But I think the point was the Ministry of Health and probably many other people, including myself, misunderstood the sickness or the lack of health in the population at large. We have a lot of smoking, a lot of obesity, a lot of diabetes, a lot of inactivity, a lot of kidney problems, and all this contributes to premature coronary artery disease, and that's what we're seeing, and we're going to continue to see it, unfortunately. And cardiac surgery and vascular surgery for our patients with peripheral disease is vitally important.
The other thing is, you're an accountant. From the economic impact of this project, I mean, this is a $100 million plus construction project. We're seeing construction workers right behind us. Like this is good for the economy too. Not that's the main reason, but
certainly good for the economy in terms of the construction. But post-construction, when it's up and running, how many new jobs have we created?
100 plus new jobs.
New jobs that are well-paying, good jobs in the community. This is going to be a big boost for the local economy.
Together